Assalamu alaikum everyone. Bismillahir Rahmanir Rahim. Quote of the day: Tell me and I forget, teach me and I remember, involve me and I learn. I am Dr. Alishba Rasool, and today the topic of my presentation is hepatitis A, and I will be presenting it under the kind supervision of Professor Dr. Saira Afzal. Learning outline: Introduction to hepatitis A, epidemiological determinants, chain of transmission, clinical features, levels of prevention, recent advances, and MCQs. Learning outcomes. At the end of this presentation, participants will be able to describe the epidemiological triad and prevention aspects of this infection, factors that contribute to its spread, and its clinical features. What is hepatitis A? Hepatitis A is a highly contagious viral infection. It is preventable by vaccine and is caused by ingestion of fecal matter. It might last for weeks up to months. What are the symptoms? Jaundice, nausea, abdominal pain. How is it spread? Direct contact, infected food, and sewage contamination. Hepatitis A introduction. Hepatitis A virus is a 27 nanometer RNA member of Picornavirus family that causes epidemics or sporadic causes of hepatitis. It has a single-stranded RNA genome that replicates in the cytoplasm of the cell. It is also known as enterovirus 72 and has one stereotype. Problem statement: worldwide, approximately 1.5 million reported clinical cases of hepatitis A. The rate of infection is probably as much as 10 times higher. It is strongly indicated to socioeconomic indicators, access to safe drinking water, and standards of hygiene and sanitation. Areas of the world can be characterized as having intermediate and low endemicity for hepatitis A. Areas of high endemicity include most of the Africa, Asia, Central and South America, including China, Pakistan, India, Nepal, and Bangladesh. Moderate endemicity include Korea, Indonesia, Thailand, Sri Lanka, and Malaysia. In less developed countries with very poor sanitary, household crowding, and hygienic conditions, HIV infection is highly endemic and most persons get infected in early childhood. Course of the disease: generally self-limited, usually less than 2 months. Relapse or prolonged HIV up to 6 months occurs in 10 to 15% of the symptomatic infection. Case fatality rate increases with age: 1.8% for persons greater than 50 years of age compared to 0.6% for persons less than 50 years of age. Persons with chronic liver disease are at increased risk for development of fulminant hepatitis A. World Hepatitis A, July 28th is the World Hepatitis Day. Agent: hepatitis A virus is an enterovirus of the Picornaviridae. It multiplies only in hepatocytes. Fecal shedding of the virus is at its highest during the later part of the incubation period and early acute phase of the illness. Host: age: more frequent among children than in adults, but all ages are susceptible. Both sexes are equally susceptible. Immunity after attack probably lasts for life. Environment: throughout the years, poor sanitation, overcrowding. Reservoir of infection. Human cases are only reservoir of infection. Cases range from asymptomatic infections to severe ones. Asymptomatic infections are especially common in children. No evidence of a chronic carrier state. Source: mainly man's feces, blood, serum, and other fluids are infected during the brief stage of anemia. HIV is excreted in the feces for about 2 weeks before the onset of jaundice and for up to 1 week thereafter. Incubation period: 15 to 45 days. The length of the incubation period is proportional to the dose of the virus ingested. Period of infectivity: the risk is greatest from 2 weeks before to 1 week after the onset of jaundice. Infectivity falls rapidly with the onset of jaundice. Mode of transmission: fecal-oral route, major route of transmission, direct person to person, indirect contaminated water, food, and milk. Parental route very rare, occurs at the age of anemia. Sexual transmission mainly among homosexual men. Symptoms: pain in pain in the right side of the abdomen, nausea, vomiting, feeling weak, dark urine, digestion disorders, jaundice, and fever. This is the main symptom, which is jaundice. Pathogenesis, hepatitis A pathogenesis, entry into the mouth, viral replication in the liver, virus presence in blood and feces 10 to 12 days after infection. Virus excretion may continue for up to 3 weeks after the onset of symptoms. Clinical findings, patients with HIV infection develop acute hepatitis. They do not develop chronic hepatitis, chronic carrier state, cirrhosis, and hepatocellular carcinoma. Pre-icteric or prodromal phase. This phase precedes the onset of jaundice by 1 to 2 weeks. Onset may be abrupt or insidious. Clinical illness is more severe in adults than in children. The patient may have mild flu-like symptoms of headache, fatigue, malaise, low-grade fever, anorexia, nausea, and vomiting. Ectatic phase. This is characterized by the presence of jaundice in 70 to 85% of the adults with acute HIV, bilirubin, hepatomegaly and splenomegaly, abdominal pain, rash, and large lymph nodes. Convalescent phase. This phase lasts for 3 to 6 weeks. Symptoms last less than 2 months, as long as 9 months. About 15% of the people infected with HIV symptoms that come and go for about 6 to 9 months. Diagnosis of acute HIV is based on serological testing for IgM and IgG. Anti-HIV. Peak titers of IgM, anti-HIV occur during the first week of clinical disease and disappear within 3 to 6 months. Detection of IgM, anti-HIV is an excellent test for diagnosing acute hepatitis A. Titers of IgG, anti-HIV rise after 1 month of the disease and may persist for years. IgG, anti-HIV indicates previous exposure to HIV, non-infectivity, and immunity. Elevated transaminases. Treatment. No specific treatment for hepatitis A, usually symptomatic and supportive. Recovery may be slow and may take several weeks or months. Therapy is aimed at maintaining comfort and adequate nutritional balance, including replacement of fluids that are lost from vomiting and diarrhea. Primary prevention, it includes health promotion and specific protection. Now, what is health promotion? Health promotion is stopping the spread of hepatitis A by promoting it through wash your hands, get vaccinated. How to prevent hepatitis A, like vaccine, wash fruits and vegetables, prescription drugs, healthy liver, clean dishes, get your nail shots, wash hands, clean drinking water. Vaccinate, educate, sanitation, and tracking. These are the core principles for health promotion. Specific protection, vaccination, active immunization. Vaccine containing HIV is available, 2 doses, initial dose followed by booster at 6 to 12 months are given. The vaccine is recommended for persons living in or traveling to endemic areas, including military personnel, patients with chronic liver disease upon diagnosis, persons with clotting factor disorder, homosexual, animal handlers, illicit drug users, sewage workers, food handlers, children and caregivers in daycare centers and institutions. Secondary prevention of spread by the rapid investigation of close contacts to ensure their proper treatment. Prevention and containment. A, control of reservoir is difficult because of the following factor. Fecal shedding of the virus is at its height during the incubation period and early phase of illness. Occurrence of large number of subclinical cases. Absence of specific treatment. Low socioeconomic profile of the population usually involved. Control of transmission. Best means of reducing spread by promoting simple measures of personal and community hygiene. For example, hand washing before and after the toilet, the sanitary disposal of excreta, filtration and adequate chlorination, water treatment and distribution systems should be improved. Control of susceptible population, human immunoglobulins to induce passive immunity, particularly those who are traveling to high endemic areas. Close personal contact of the patient within 1 to 2 weeks of exposure prevent illness in 80 to 90% of the exposed. And number 2 is the vaccines. Now, what is the right formulation? Hepatitis A, hepatitis B, and Twinrix. Remember, always use the age-appropriate dose. Vaccine of hepatitis A, 12 months through 18 years, 0.5 ml, 19 years and older, 1 ml. Hepatitis B, birth to 19 years, 0.5 ml, 20 years and older, 1 ml. Twinrix, 18 years and older, 1 ml. Recent updates. Hepatitis A key facts. Hepatitis A is an inflammation of the liver that can cause mild to severe illness. The hepatitis A virus is transmitted through ingestion of contaminated food and water through direct contact with an infected person. Almost everyone recovers fully from hepatitis A with a lifelong immunity. However, a very small proportion of people infected with hepatitis A could die from fulminant hepatitis. The risk of hepatitis A infection is associated with the lack of safe water and poor sanitation and hygiene. A safe and effective vaccine is available to prevent hepatitis A. WHO response. In May 2016, the World Health Assembly adopted the first global health sector strategy on viral hepatitis. The strategy highlighted the critical role of universal health coverage and sets targets that align with those of sustainable developmental goals. The strategy proposed the elimination of virus hepatitis as a public health threat by 2030 and included a roadmap towards elimination by implementing key prevention, diagnosis, treatment, and community intervention strategies. In May 2022, the 75th World Health Assembly noted a new set of global health sector strategies on HIV, viral hepatitis, and sexually transmitted infections for the period of 2022 and 2030. Based on these previous and now new strategies, a broad range of member states have developed comprehensive national hepatitis programs, elimination strategies guided by the local health sector strategy. WHO is working on the following areas to support countries in moving towards achieving the global hepatitis goals under the Sustainable Developmental Goals Agenda: raising awareness, promoting partnerships, and mobilizing resources, formulating evidence-based policy and data for action, increasing health equities within the hepatitis response, preventing transmission, scaling up screenings, care, and treatment services. Hepatitis A, epidemiology and prevention in developing countries. For populations with a highly proportion of susceptible adults, implementing vaccination programs may be considered. In this report, we review available epidemiological data and implementation of vaccine strategies, particularly focusing on developing countries. Hepatitis A and B combination vaccine is used to prevent infection caused by hepatitis A and hepatitis B virus. The vaccine works by causing your body to produce its own protection against the disease. Hepatitis A and B combination vaccine is recommended for all the person 18 years of age or older who are at risk from infection from their jobs or some behaviors or from traveling to the following parts of the world. Hepatitis A and B combination vaccine is also recommended for military personnel, persons living in or moving to areas that have a high rate of HIV infection, person engaging in high-risk sexual activity, person who use illegal injection drugs, person at risk to their work, such as laboratory workers, people who work in child daycare centers and correctional facilities, residents of drug and alcohol treatment centers, and patients and staff in hemodialysis units, people who are at the increased risk of HPV infection and who are in close contact with patients that have hepatitis A or B, persons with hemophilia, and persons with chronic liver disease. Now it's time for MCQs. Number 1, which of the following hepatitis A vaccine product is or are available? A, combined hepatitis A and B vaccine. B, combined hepatitis A and C vaccine. C, monovalent hepatitis A vaccine. D, combined hepatitis A and typhoid vaccine. E, combined hepatitis A and cholera vaccine.
A.
Yes, A is the right answer. In case of infection of hepatitis A virus, percentage of the patients showing signs and symptoms: A 1%, B 3%, C 10%, D 15%, or E 20%.
D.
It's E 20%. Which of the following statement is not true regarding hepatitis A? Incubation period is 15 to 45 days. Maximum infectivity is 2 weeks before to 1 week after the onset of icterus. Chronic carriers are responsible for epidemics. Large number of subclinical cases are seen. 0.5% sodium hypochlorite is an effective disinfectant for patients' faces.
B.
It's C, chronic carriers are responsible for epidemics. Which of the following statement is not correct in relation to hepatitis vaccine? Is formalin inactivated and adjuvanted vaccine not recommended for children before 1 year of age? Can be combined with hepatitis B vaccine? Cannot be given to older children? Can be given to older children?
B.
It's D, cannot be given to older children. You have a friend who's going to China for 7 months. She leaves in 2 weeks. She has never received hepatitis A vaccine. What is the best choice today for her immune prophylaxis of hepatitis A? A dose of hepatitis A vaccine, a dose of IM immunoglobulin, and a dose of hepatitis A vaccine, a dose of IM immunoglobulin, first dose of hepatitis A vaccine today, and a booster dose the day before she leaves.
B.
No,
B.
it's a dose of hepatitis A vaccine. In a family, husband developed hepatitis A infection, and during visit to the clinic, the doctor recommended disinfection for clothes and toilet. What is the most effective disinfectant in this case? A. Chlorine, B. Iodine, C. Formalin, D. Malathion.
A. C.
It's A. Hepatitis A vaccine is routinely recommended for the following groups: food handlers working in a shellfish market, individuals going to reside in Spain, sewage workers, patient with chronic renal disease, E. Injecting drug users.
C.
Yes,
C.
C is the right answer. The diagnosis of hepatitis A virus infection is carried out from the method based on aminotransferase levels, detection of fecal HAV by immune electron microscopy, complete blood picture, detection of IgM anti-HAV by ELISA.
D.
It's D.
D.
D is the right
D.
answer. Which of the following group of people are not considered in the increased risk of acquiring HIV infections? People traveling to developed countries to developing countries, men having a sexual relationship with other men, people working with primates, babies born to mother with HIV.
D. B.
It's C. It's
A.
D. It's D. A 32-year-old man comes to clinic with abdominal discomfort and vomiting, low-grade fever. The diagnosis was done and he was found to be infected with HIV. In a blood sample, IgM antibodies detection confirms the HIV infection. How long after the initial infection these antibodies are found in the blood? A. 24 hours, B. 3 to 4 days, C. 1 to 2 weeks, and D. 12 hours.
C. C.
C is the right answer. This is the key, and thank you, everyone.
Thank you very much. Very nice presentation. The most important part about hepatitis A and B is that each has the merit to be presented, say, separately, because both are the most common hepatitis in Pakistan. Whenever we talked about the developed countries, we know that they have been able to eradicate hepatitis, especially the viral hepatitis, at most of the places. So, in developing countries, still we are having a lot of problems with the hepatitis A and B. As hepatitis A is usually self-limiting, and the most of the chronic hepatitis is present with hepatitis B. So, hepatitis B is more dangerous whenever we talk in terms of mortality and morbidity. Similarly, we know that there are the symptoms that are very common between hepatitis B and A, like jaundice, yellowness in the sclera, and conjunctiva. And also, there are certain people who have the diarrhea and they have abdominal pain. Sometimes they also suffer with other things like fatigue and generalized weakness. So the vaccines are the most important part for the prevention of hepatitis, both A and B. And we know that if it is the cirrhosis, then it is very difficult to get hepatitis B the patient transplant. We know that the transplant facilities are very limited, and they have to go for transplant as the hepatitis B chronic disease may lead to mortality. So the symptoms may include abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue. And when there is any yellowness in the eyes, it is the time to take precautionary measures, prevention, and all EPI programs. They include hepatitis B vaccination in order to decrease this disease, burden of the disease, as well as the complications like cirrhosis of the liver, and to decrease the requirements for the transplant. These are one of my very important research topic, the hepatitis B infection. And we have seen that newer drugs have been developed, especially one of a very important drug is Zephyx that has proved very effective against hepatitis B. Similarly, in future, we are going to have oral vaccines and oral chemoprophylaxis against hepatitis B. Similar research is needed for hepatitis A, and this is the need of the time to develop oral vaccines as well as oral chemotherapy and oral medicines to decrease the burden of the disease. Here are my 2 cents in this discussion. Thank you very much for a wonderful presentation. Allah Hafiz, everyone.
Allah Hafiz.
Allah
Allah Hafiz, ma'am.